So I want to take the next couple of minutes to explain what is Rhesus sensitization. So to get to start with that, I want to explain what is a Rhesus factor. I won't go into the medical molecular conversations. I'll just put it bits and tips so that everyone can just flow with it. Now, when you go check your blood group, you'll hear something like you are A positive. The AA is your genotype. The A positive is your blood group. The positive, that plus the right, explains your Rhesus status. So if you are AS O negative, it means your genotype is AS, but your blood group is O, and your Rhesus genotype is negative. So let's put aside the genotype, let's put aside the blood group. Let's talk about those plus and minus. These are extremely vital things you need to understand. I've interacted with more than 400 young ladies on this topic, and to my greatest surprise, less than 2 out of the entire 400 I've interacted ever understood the implications of being Rhesus negative or even being Rhesus positive. So the only person I've met of recent, I was at the Nigerian Army radio in Abuja in Nigeria, and then I met with the presenter, a wonderful lady. I went to do a talk on some health issues on radio, and we talked about my book, and she screamed the moment I just mentioned it. She told me, I know where you're going to. I'm Rhesus negative, and I was very fortunate as a young girl that my uncle was a medical doctor, and he visited when I was just a young girl. The day I started seeing my period coincided with his visit, and he sat I and my parents down, asked a couple of questions, and when he learned that I was O negative, he began to educate me on the implication, and it later saved her a lot of trouble, which I'm going to talk about as we progress. So let's get to it. So when a woman is Rhesus negative, in essence, O negative, A negative, AB negative, whatever negative, it is very, very important you listen to this. What it means is that the factor called Rhesus is not present in your blood system, established. So anyone who is Rhesus positive has the Rhesus factor present in their blood system. Put that aside. Now, a woman and a woman cannot conceive a child together, right? Speaking medically. So for a woman to conceive, he has to be married to a man, right? Or has to have intimacy with a man. So if a man is Rhesus negative and a woman is Rhesus negative, when they come together, there's no possibility per se for them to have a child that is Rhesus positive, because this is negative, negative. None of them have the Rhesus factor in their blood. So put it aside. When a woman is Rhesus positive and the man is Rhesus positive, it means the Rhesus factor is in her own blood, Rhesus factor is in the man's blood. So when they give birth to a child, the child will be Rhesus positive, but the thing in the child is already in the woman, so there's no problem. So when the woman is Rhesus positive, but the man is Rhesus negative, meaning the man has no Rhesus factor in his blood, when they conceive a child, the child will take after the Rhesus status of the father. The child will be negative. And when the child's blood gets into the mom, it will not create any impact because it has no Rhesus. So there's nothing to be worried about with these people. So the only time we have a concern is when a woman is Rhesus negative and the partner is Rhesus positive. That's when there's a concern. And I'm going to break it down from here going forward. Because when the man gets the woman pregnant, the child will be Rhesus positive. And from here, let me explain what happens. Follow me very, very closely. During the process of conception, there is a little, take notes, the baby is in the mother's womb. So everything the baby feeds comes through the mother to the baby. And this happens through a blood flow connection. Very basic explanation. So the oxygen the baby receives is through the blood from the mother to the baby. The food the baby receives is from the mother's blood to the baby. Now, when all those things get to the baby and the baby is done using them, they need to also be removed. So they return back to the mother's blood. There's a proper filtration that happens to make sure it is just the right things that get back. However, there are chances that there will be a little blood mix, meaning that some of the blood from the baby in the womb may return back to the mother. So because of that, around 22 weeks of pregnancy, if a woman is rhesus negative, we usually give an injection that will prevent that baby's blood from reacting with the mother's blood. That injection is called Rhogam, and I'm going to talk about it shortly. So now, as this baby's blood gets to the mom, let's assume that the Rhogam was not given. The mother's blood will see. Remember, the woman is rhesus negative, so no rhesus factor in her blood, but the child is rhesus positive. So when the rhesus factor from the baby's blood touches the woman's blood, the woman will see that as a foreign attack. It will consider it an illness and immediately develop antibodies to kill that stuff because it sees it as something that have come to attack it. Those antibodies it developed will be stored in the woman's body. Follow me. Then the pregnancy will continue, and at the time of delivery, when the woman is in the labor pushing, push, during the process of delivery, there's a significant blood exchange between a woman and her baby. When that blood exchange happens, follow me now, the woman's blood already has antibodies that fight rhesus factor. So when that her blood moves to the baby, there are two pipes. One is going to the baby, one is coming from the baby to the woman. So, and they just pass each other like this. So when the blood from the woman goes into the baby, remember it already had antibodies, but they were small. There is not really a large quantity, just a small quantity. So it will go into the baby, but the baby's blood, a good volume will flow into the woman. So this woman will receive this second exposure to the rhesus factor from the baby. And this time around, it will build more antibodies. But nothing happens to the child. Why? Because the amount of antibodies that will get into the child from that first pregnancy, remember, it was just a little mix that happened when the baby was in the mother's womb. Sometimes it may not even mix at all. So this first baby that will be born, nothing will happen to the child. At most, the child may have some jaundice, have some fever, but will just recover. But remember, this is the baby's blood during the time of delivery. A large amount has gone into the woman. So the woman will build massive antibodies. Let me take you away from what I'm teaching and bring it something very relatable. Let's say you have a business premises and you show up on a work day and realize that the place has been boggled. What do? You want to change your locks and a few things that secure your premises. And then you continue doing business for several other weeks. And then you come some months later and realize that the place has been boggled again. What do? Let's say you inform the police, you put some CCTV camera, you advance your security measures. So what am I trying to explain? For each time you have an attack, you improve your security measures. A time may come, you even put some invincible laser so that if a criminal goes there, let it just slice the guy to pieces, right? So in the same way, for every time a woman's blood is exposed to rhesus factor from the baby, it will build more defense than it had previously. First pregnancy has gone successfully. The child just had little ENS jaundice when he was born and was treated and was fine. But take note, the woman is no longer the same. Her body right now carries soldiers that will fight anything that is rhesus positive. So she takes in a second child. And when she takes in the second child, the situation is very different right now. That thing that happens within the first 22 weeks, where there's a small blood mix between the baby and the mother, especially if she's engaged in vigorous activities like running, or if there's a trauma to her stomach, like a punch to her stomach, maybe something happened, or she fell, and there's a blood mix between the woman and her baby. Remember, it is no longer a small amount of antibodies in her blood. Her blood has massive army. So even a small quantity of blood carries a high density of antibodies. So the baby right in the womb will begin to struggle. Some of them may not even make it. But let's say that they even make it up until delivery. At the time of delivery, there's now massive blood exchange between the baby and the mother. This one is going from the woman to the baby, and this one is coming from the baby to the mother. Remember, this child is still rhesus positive. So when the blood gets into the mother will be further challenged to build layer 3 level of antibodies. Now super amazing soldiers built up in her system. But before that, remember, the woman's blood also has moved into the baby. And this blood that is moving from the woman has massive antibodies from the previous pregnancy that happened. So when this blood gets into the baby would instantly begin to have severe complications, and we call it Rhesus disease in the child. So the child will have severe jaundice, child will be in distress, child will have high fever, a lot of things will happen, and the child will just die within days to weeks. But that's not just the problem. Remember, before the child died, during the time of delivery, more blood moved from the baby to the woman. So now the antibody she has is more advanced than the first pregnancy. So she takes in the third time. They will think maybe this is something went wrong in this pregnancy. She takes in several months later. And this time around, once there's any small blood exchange while the baby is still in the womb, the baby will die inside the womb. Or if at all the baby does not die in the womb, the moment the baby is born, the quantity of antibodies the baby will receive will fight the child and kill the child within hours or maximum a day or two. And this will now begin to be a cycle of every pregnancy will lead to death. But it doesn't even get to that. It doesn't even advance to that point. You now see that every pregnancy will lead to miscarriage because the woman's blood will keep fighting every baby she now conceives. And that is how Rhesus negative women are affected, and they must be careful because of this. But now, let's not even move away. Remember, this woman was lucky. She already had a child. So we're talking about subsequent children. What about a lady who got exposed to Rhesus factor by other means? For instance, she had an abortion. So if a lady has an abortion, and remember the process of abortion is just to slice up a child who is already forming in the womb and pull it out in pieces. Now that process of doing that, there's a lot of blood mix between the child that the woman is removing and then the blood of the woman also. So she gets sensitized due to an abortion if she's Rhesus negative and the child is Rhesus positive. So later in the future, when she tries to start having children, it will just be miscarriage back to back. Or if she carries a child to term, gives birth, the child will just die. And that's a problem. But it doesn't even end there. She could also be sensitized because she had some blood exchange, maybe blood transfusion, which is the case of the lady presenter I met at the Nigerian radio. So she went to the hospital and for something that required blood transfusion. And on getting there, the results came out. They did a routine, they checked her blood, and it came out with Rhesus positive. And she told the nurse who came there that this is not my result, I'm Rhesus negative. And like it's typical in some health settings, some people feel like you don't teach me my job. But this is why you don't allow sentiment to rule over your discretion in matters like this. She said, "Madam, I said, this isn't my blood. So let's go do another test. I don't even mind pain, but let's do a test and I want to be there myself." After some whatever, she spoke with the doctor and insisted. The doctor obliged and they went for the test. They did the test and she was Rhesus negative. The lab scientist, the head of the department, showed up, met her, sat down and apologized and all. She said, "I'm not even interested in making trouble." But just imagine if this lady had not been told by her uncle as a 10-year-old, 11-year-old, 12-year-old girl what her life would have ended up being. She would have received blood transfusion from a Rhesus positive person. This one is not just blood exchange, transfusion, 2 pints of blood. Her life would be messed up reproductively. And she came out of that. So yes, blood transfusion, abortion, pregnancy, or even sharing of sharp objects and needles, because you just need 0.1 ml of the Rhesus factor concentrate in any volume of blood for a woman to become sensitized. So it's that important that you know that. All right, that's why you have to be careful. But what do we do to prevent this? When a woman is Rhesus negative, we use a drug called Rhogam. So I want you to just see Rhogam as those same antibodies the woman would have formed herself. So we form it in the laboratory and then we inject into the woman. What we're saying is your blood should not react. We've given you antibodies already, but we've given it in just a quantity enough to fight the Rhesus factor from your baby or from the abortion or from whatever. So we'll give a quantity that is significant for them to do a reaction and just neutralize it. So the woman's blood is not exposed to it. So when I mean by that, we inject into the woman's blood. Let me not go into the molecular aspect, but just understand that that's how Rhogam works. So if a woman is given Rhogam around 22 weeks, We also give it when the woman gives birth to a child. Previous data says you should give Rhogam between the time a woman gives birth to a child and up to 72 hours. But right now, current data show that even up to 28 days, if Rhogam is given, it can still protect a woman. So someone benefited from this. So I went to see a family that gave birth to a child and then gave my gift and prayed with the kids. And then the child who was born, just as I was about leaving, I just went back and said, so what's a Rhesus status? She said she didn't know. And they gave birth in a maternity home. So none of these routine things that we do under professional settings were done. So I sent the husband and they went the same day and did the blood test, and they called me on the phone. They say, hey doctor, she's O negative. It was already 2 weeks past the time she gave birth by the time I came to visit them. With this information I have about the recent data on how Rhogam works, I sent them back to the hospital and did a reverse Coombs test, which is the test you do to confirm if a woman has been sensitized already. Unfortunately, she wasn't yet sensitized, so she received the Rhogam and was protected. When I mean this sensitized, it doesn't happen. It's not like the moment the blood mixes from the woman to the baby, instantly happens. It builds up. It's a reaction. It's a reaction. It has to go through the entire body system to react to build it up. So, like I said, I want to go into the molecular discussion on immunology, so I'll just keep it on the surface. So she received the Rhogam at 2 weeks and was protected. So it's important you know this. So if you know someone who had an abortion 2 weeks ago and you're meeting her today, still tell her to go do the test. We call it a reverse Coombs test. I'm going to put it in the description or in the chat room so that everyone could see that. When you go to the laboratory, you request for this, all right, or what we call indirect Coombs test, and then you see if you've been sensitized already or not. Because once a woman is sensitized, it is not reversible. There's nothing you can do about it for life. And that's why it's a problem. Okay. So that is what you need to know about Rhesus. So I want to take a few questions. Just go to the chat room and just take as many questions as I can. And then we'll draw the curtain until next series. Okay.